Hi guys, welcome back to my channel. This is a really exciting video for me today. I'll take you guys through my hopefully very successful nose job process, and I'm gonna take you guys with me through every little detail, every step of the way, just so you guys can get the inside scoop, so I can hopefully answer some questions for you guys. I'm just gonna preface by saying nobody needs this, but I've wanted this my whole life. It's as simple and as straightforward as that, so I'm gonna get one. Today is Wednesday, May 29th. It's 12 o'clock. I had my first consultation appointment with my doctor today at 2 o'clock, so I need to get ready and then we're going to that. I will bring you guys along, but I just wanted to, first of all, run through what I want. I really don't want to change too much. I really like the way I look forward facing. I truly don't mind it. My problem is my side profiles. I know we all are our biggest critics, and like what you guys don't notice, well, I noticed, you guys probably don't notice that much, but like I said, this is something I wanted my whole life, so I'm just gonna do it. So my side profile, I feel like I have two different side profiles, so I definitely just want to smooth that out and make it way more symmetrical. I do want to shave down my bump a little, just, you know, it is what it is. If I'm gonna go do all this stuff, then I'm gonna shave down my bump. But really, I don't want to change much other than that. I want it to stay very much the same from forward facing. I'm basically just messing with my side profile. So that's the goal, nothing crazy. That's what I'm gonna tell my doctor. I have a few pictures. I'll show you guys the pictures I'm gonna show him just for more details. But so this is the nose that I think would look best on my face from like a side profile view. I'm like, I'm not doing a slope. I don't want that. I don't think it would fit my face. I very much want this new nose to look like I was born with it. Like I want it to look like mine still. So yeah, definitely just doing just literally a straight bridge, no tip lifted. Here's another picture of like front facing view. I very much do not want my nostrils to be like showing very much. I want them to stay like really, I feel like I have pretty small ones. They're not very like in your face, so we're keeping that. I went with my mom to her first nose job consultation appointment, and basically what goes down is we're gonna go in, they're gonna take all like my pictures, I'll talk to the doctor and I think like tell him, you know, why I want this and like what I want to do to change my nose and stuff. And then they'll give me, I think they'll give me like a rundown of like pricing wise what it will look like, and then schedule it. It's really, from what I remember from my mom's appointments and things, it's really pretty fast. There's not much like in the middle. They will send me a picture of kind of like a mock-up of what we talked about and then what it would look like. So I will show you guys that when I get it. Probably won't be for a few weeks, but yeah, I'm really excited. Hopefully this video will answer lots of you guys' questions. If not, you can always comment them below and I'll try and answer. But yeah, I'm excited to bring you guys along. This is new for all of us, so I am nervous. Like I said, I've wanted one my whole life, but now that I'm this close, I've been like really thinking hard about it and like looking at everyone's noses, looking at my nose, and like truly it's so scary. It's so scary to do this, but I really think I will be really happy with it. Alright, let's go. I'm kind of nervous. Yeah. So first one, I'll have you look straight at the camera. Perfect. 1, 2, 3. Tilt your head back for me. There's perfect.
Scott Thompson. Thompson.
Basically from the front, I want it to look the same. I don't know if you can do that. Like, I don't want my nostrils moved at all. I like the way it looks from the front. And then just kind of shave the bump. My thing with shaving the bump is, though, I don't want it to look like really long. So if we need to like push it back, I would like to do that so it doesn't look crazy long. But then again, I don't want it to look different from the front. So I don't know if you can do all of that.
Okay. So you like the way that it looks when you look in the mirror straight on?
Yeah.
Turn toward me a little bit. That's good. Now tip your head back.
Yeah, okay. So if you were to just take this bump down, do nothing else, I'm going to do a little morphing on the computer and show you what that might look like. I don't think it would make your nose look too long.
Okay.
And I think that what we call the projection, meaning how far it sticks out, is pretty proportional with the rest of your face.
Yeah.
And, you know, if you're not really wanting to change anything from the front, then that actually becomes a less involved rhinoplasty in a way, and a little bit easier to recover from, also a little less risk. The more you do, the more potential problems you could have with the nose. So, and this is taking the bridge down. It's not scooped out at all, or it's not
I
low.
don't want it scooped.
And you don't. If it did, I think it would look too projected. But this, I think, is very achievable without changing your tip at all. And I agree with you. I think when it looks, to me, when it looks scooped out, it just looks like a rhinoplasty. Do you like how that looks?
Yeah, I do. I still worry that maybe this looks a little far. I mean, I know it's just because now I don't have the little bump to balance it, but...
Yeah, you know, it's possible we could take it in just a tiny bit without, you know, changing the way that it looks like from the front. But the more you bring it in, the more it's going to want to make the bridge or the tip kind of look wide. You know, so, but I think if we just brought it in like a millimeter or two and brought the bridge down, I think that would be doable.
Yeah, no, I really like that.
So this is what we call a closed or there's an external or an internal rhinoplasty. So with this one, we can actually make all the incision inside your nose.
Oh, okay.
So there's no stitches on the outside, they're just all on the inside. And essentially, I kind of go through the inside and then lift the skin off of the bridge of the nose and then just kind of
just
shave that down. And then we have, but with that kind of view, just to make sure we're, you know, communicating, we're on the same page. I think that type of result is very achievable. There's a cast on your nose for 1 week. You'll have dissolvable stitches. You won't have any splints inside your nose, so that makes the recovery a little bit easier. Probably not a lot of pain. It's just mostly just, you know, you may have some black eyes, and you'll probably have some swelling, but I think you'll be surprised at how easy the recovery is when you're not taking everything apart and putting it back together. We'll see what we can figure out, okay?
Perfect. That sounds
It's
great.
nice to meet you.
It was nice to meet you too.
Yeah, have a good day.
Thank you.
Your total is $4,710.
Perfect.
So he plans on this being about an hour. It will be in the operating room, of course. And then we have our surgeon's fee here. Arnica, we do give you arnica to help a lot with bruising, post-surgery, anesthesia, and then that facility fee.
Good morning, you guys. Today's the day. Let's get ready for my nose job. My surgery is today at 1, but I have to be there at 12:30. I just have a few things on my list of to-dos. I need to take off my clear coat of nail polish. Can't have any nail polish on. Need to take it off my toes. I need to shower, wash my hair, put my hair back in braids, make sure nothing's on my face, like no lotions. I need to take my jewelry off. I've been fasting since 12 last night, can't drink any water since 6:30 this morning, and I've already picked up all my medicine and stuff. Me and Reg are gonna probably set up a little area for me to come back to when I'm done, but basically that's it so far. But I'm gonna give you guys the rundown again, because I don't remember if I gave it to you already, but I'm gonna give you the rundown again on surgery cost and everything that we're doing. Okay, so for everything that we're doing, I really didn't want that much, you know, I just wanted it straight, basically just a bump shave. I didn't want anything, like I want it to look the same from the front. I didn't really want anything messed with, didn't want like my nostrils moved or anything. basically just a bump shave. But then I was thinking I don't want it to look long if you take out the bump, because the bump kind of balances the length. And so we're doing a little bit of tip work, just trying to push it back slightly, ever so slightly, to keep it looking the same but proportionate. So the total cost of surgery, the breakdown, yeah, so the procedure fees are minor tip work, which is $1,000, and then the rhinoplasty dorsal bump shave. And it's a closed procedure, so I won't have a line. It won't be open. So yeah, I won't have a scar there, and that is $4,250. And then anesthesia is $550, and facility fees are $950. And then, so the total cost of everything I'm paying is $5,680. That is the total cost. The tip work added a little bit, which is totally fine, because I'm like, I just want it to look good. I don't want to have to do this again, even though, like, I know I might. It's a possibility. Rhinoplasties have, like, the highest revision rate. Like, everybody says if you get one, you probably will get two. Just, I don't know, just because it's such a hard feature to mess with on your face. Anyways, let's get ready for the day. Hopefully all goes smoothly. I'll try and record when I can. I'll try and have Reggie record when I can. Nails are officially off. I literally haven't had bare nails in years, like legitimately years, which is probably a good thing that I am giving them a break now. Anyways, nails are off. Toenails are off too, but I'll spare you from seeing those. It's 9:42. I have to be there. I have to be leaving my house around 11:55. The only piece I'm gonna leave in for the moment is this one new piercing I got. It has been like 5.5 weeks, which technically you can take them out at 6. So I'm just gonna leave this in as long as possible. Probably take it out as soon as I get there. But other than that, everything else has to come out. Honestly, I hate being bare. I love jewelry so much. Okay, now the bracelets. I literally wear these things 24/7. I never take them off. One necklace down. Necklace 2. Last necklace. Okay, out of the shower, I washed everything, washed my hair. I'm not allowed to put like any sort of cosmetic, lotion, skincare, anything on. So haven't done that. I'm feeling a little bit dry. Also, nothing can go in my hair. And I need to have my hair back, so I think I'm gonna blow dry it and put it in braids. But yeah, also shaved my legs in there. I'm not sure why, but the thought of me being like completely out of it on a table with hairy legs didn't sit right with me. Okay, I'm dressed and braids are in. Last thing I need to do is just pack my bag for like when I get changed and get out. So I'm literally just packing sweats and a zip up. I'll show you. Literally just basic sweats, and then just this oversized zip up hoodie that is perfect for putting on after a surgery like this, because it's zip up so it doesn't have to go like over my face. That's literally it. I am officially ready to go, I think. I'm really nervous. I'm scared. I literally am just scared for the recovery. Basically, that's it. Actually, I'm scared about going into the surgery room and seeing everything and knowing that they're gonna like cut me up. And that's what I'm scared about. And then I'm scared about waking up and just being in pain.
Feeling sick.
Yeah, I hate feeling sick. But other than that, like, I'm not scared for the results. I think I'll like them, and I think that will be fine. But literally just scared for, like, the pain in recovery. So that's what's getting my heart pumping right now. Okay, let's go in.
Any last words before you go in?
Say goodbye to the nose.
Let's give one good look and good turn for us all.
I'm ready. the worst it's looked so far. And I'm guessing that it will slowly start getting better from this. I'm hoping. If not, I think we only have like one more day of getting bad and then it will start getting good. If today's not the last day, but really not bad at all. Post-surgery, this is my bruising and swelling for the day. It's really nothing bad at all. It's super like bearable. I feel like this is pretty minimal swelling and bruising too. Like this is probably the worst it's looked. Maybe yesterday was the worst it looked, but this is it. There's basically no pain. I'm only taking extra strength Tylenol, and this is just like annoying. It's not like painful, it's just annoying. Pain has been like so minimal. I did have to take painkillers for like 3 days after. I did go under anesthesia for the surgery, so didn't feel anything. Woke up feeling totally fine. Throughout the day I got a little bit nauseous and I had them give me some medicine just for like nausea, but other than that, this has been like the easiest, most straightforward, simple thing I've like ever gone through, like surgery wise, and it's just like way more relaxed and like not as intense as I thought it would be. And like the pain is not intense, and like I don't know, everything's gone so smoothly so far. So yeah, just a quick little update. I'm literally sitting down to literally edit this YouTube video that you're about to be watching on here. Just thought I'd give you like a good bruising update. I'll try and record some of the things I have to do, like sleeping at a 45-degree angle. I literally just put like 5 pillows up on my bed and just sleep against 5 pillows, and then I just have to like change this out pretty often and spray saline up my nose, and then just take the medication that they provided me, which today, the 5th day, is literally like everything is run out. Like today's the last day, so it's been really easy, you guys. Really easy. I don't know. Maybe I'm like jinxing myself. Obviously, the hard part I feel like comes when I have to now get used to a new nose, a new face, which I did go through. I will say, like on the 3rd day, I almost cried. I have not cried. I almost cried on the 3rd day because the bruising was a little worse and like the swelling mostly was worse, so I looked a little funky, and it definitely can be an emotional roller coaster, which that I'm just like mentally preparing for, because I know when I get this off, it's gonna be swollen. It's not gonna look how I want, and that's just how nose jobs go. Like it's not gonna look how I want for a few months probably, which that I'm preparing for, and I think that's gonna be the biggest challenge. But I'm hopeful that like with taping it, and because it was so minimal, like the work that I had done, I'm hoping that the swelling and results will show up sooner than later, because a lot of people say that you need to wait up to a year to see results, which I will. I'll wait up to a year to really say these are the final results, but I'm hoping that I can get used to it a lot faster than that, because I don't know, it's just such like a mental, emotional game. Messing with your face is a huge thing. So yeah, that's the one thing I'm nervous about, but other than that, everything has gone really good. Okay, ignore the lighting, but we just pulled up to the like week after surgery appointment, hopefully getting this off. I'm pretty sure I'm getting this off. I'm a little scared that it's gonna be really painful because my nose is so tender, like underneath, but yeah, come with us.
very swollen,
Yeah.
but
Sure.
you'll get a little idea.
Oh, wow, it looks so good.
Looks cute, huh?
Yeah, it looks really good already. Cute.
Yeah, if you were to go out in public, nobody would even.
Yeah, no, it looks good already. That's crazy.
I'm gonna wipe it with some alcohol just to get some of that tape off. Feels funny, huh?
Yeah, it does.
Now I'm going to teach you how to tape your nose. You're going to want to do this every single night. During the day is optional, but you don't have to if you don't want to. Do you have somewhere to go today? No? Okay. Perfect. So do you want me to place the tape and leave it on for the rest of the day?
Sure.
Okay, beautiful. So what you want to do is you're going to basically want to do a little Christmas tree. You start off from the smallest, and I cut the top one in angles just so it doesn't poke your eye out. And then you go down from there, and then a longer piece for your tip, and then 2 extra pieces to secure that tip.
Okay.
And we'll apply some pressure. Just hold it out. You just want to help gravity. And 2 extra pieces to secure that piece. And then the best way to take this off when you're ready to take it off for the day is castor oil or baby oil, just to soften it up.
Okay.
If not, it's going to kind of hurt you when it's time on your skin.
Yeah.
But that's about it.
Perfect.
Okay, it's been 2.5 weeks since the surgery and like a week and a half since my last appointment, since getting my cast off. I think this appointment is just like seeing the doctor and having him look over everything and make sure it looks good. The healing has gone really well so far. I do have like a few swollen spots that are like kind of turning into little knots. So I'm not sure. I know you can get like steroid shots in your nose for that to help. So I'm gonna ask him about that. But other than that, everything looks really, really good. And I'm excited to see what he says. So of course, I'll bring you along.
Okay, so you're gonna look straight forward, neutral expression, 1, 2, 3. Okay, then I'll have you look up to the ceiling. I'm gonna have you look at this butterfly right here, 1, 2, 3.
Overall, there's a little bit of fullness right here, and that may be a little bit of swelling. It could be a little bit of just cartilage prominence, and sometimes when I see that, I'll just in the office, I can actually take a needle and just sort of like scrape it down a little bit.
Oh, really?
Yeah, but let's give it, I'll probably give it like a couple months for all the swelling to go away.
Okay.
And then we'll know for sure. It is a little closer, which I'm loving that. I noticed just in your
it looks
profile,
really
so I think we got that, we nailed that.
Yep.
But I think just right there, there's just a little bit of fullness that I'd love to see gone.
Yeah.
So why don't we give it, we're 2 weeks today, is that right?
2 weeks and like a half.
In a bit? Okay. So yeah, let's do this. Are you taping still?
Uh-huh.
So I would mainly tape right along there where you see that little bit of fullness.
I've been doing that like throughout the day. Should I just...
You can do it probably at nighttime, unless you're just hanging around home, and you can do it during the day as well.
Okay.
But I'd say, maybe let's see you in 4 to 6 weeks from now. And I think most of the swelling should be gone by then.
Yeah.
And if this is still persisting, maybe even at that appointment, I might do that little needle shooting thing. So basically what it involves is I just numb up your nose a little bit, and I just go in with a 18 gauge needle, and since this is not bone, it's cartilage, I can just kind of like, smooth it down a little bit.
Yeah,
and I don't see it often, but once in a while I'll see that, and it's nice when it's down there because it's cartilage. If it's bone, you have to actually go back and rasp, but I think we can do that.
The other question I had was, I think it's this side. There's like a little bump
Bulge
right there, and I don't know if that's just like weird healing or
turn toward me just a little bit.
like you can kind of catch it when there's like light.
It's your nasal bone, and when I break the nasal bones, a lot of times there'll be kind of a little bit of an edge, and usually like this one you can feel a little bit of a step off on the other side where that's broken. So on that, I would also just watch it. If it ends up being a little bit of a bulge, then even in the office, I can actually go in and rasp that a little bit too. That's the
so
thing
we'll
with
just watch
bridge
everything.
stuff.
Yeah.
A lot of times there's like little kind of modifications you have to do. But let's see you back in like 6 weeks.
Okay.
And we'll decide if I need to make any of those little adjustments.
That
But
sounds good.
They're very simple things.
Yeah,
that we
no,
can do, so.
it looks really good.
I'm loving it overall. I just feel like there's a couple little things that we might be able to do to make it slightly better if they don't go away on their own.
Okay, perfect.
Good. And your breathing's okay and everything?
Yep.
Perfect.
Yeah.
Beautiful. All right.
Everything's
Good.
been
So
great.
let's plan. Just stop at the front. They'll schedule that appointment.
Okay.
4 to 6 weeks. We'll check everything. And if I'm going to do the rasp as well over here, I'll probably reschedule because I'll need to get a little bit more time. But if it's just the needle thing, then we'll just do it on the spot.
All right.
Okay.
Sounds good.
Thanks, Olivia.
Thank you.
Tomorrow will be exactly 4 weeks since the surgery. The nose is looking stunning. At my last appointment, we did talk about this little like scar bump that's popping up. It possibly could go away on its own. If not, then he's gonna go in with a little needle like he said. I'm so happy with the results. I'm really happy with the way I went about this, trying to keep my, you know, character and my face really close to what it was before, but just feeling a little bit more confident now in the way that I look and my side profile and everything. I'm absolutely in love. My nose was never ugly before. It was never ugly, but it was just something that I personally was always a little bit insecure about. And my nose now, I'm absolutely obsessed with. I love it so much, and this experience has truly been nothing but good. I like really can't say enough good things about Utahfacialplastics and Dr. Thompson, and just how smoothly everything has gone, and recovery and results and everything. It's just been so perfect. So hopefully this gives you guys a little more insight about like what a nose job all entails and the process and everything. I'll show you guys a few nose pictures of the process again, just because I like the visual. Okay, so this is my nose day of surgery, and this is right after. Day 2, day 3, day 4, day 5, day 6, and day 7 when I got my cast off. And then this is exactly 2 weeks after. 3.5, almost 4 weeks after. But yeah, thank you for watching. I love you guys so much, and thank you for all the support.